Yeah, that's a good question. Now, the blood sugar was 190, and your blood pressure was 170 was the high.
177 or 90.
177. Now, both of those are high and abnormal. Okay? Now, we could take a little bit of the metoprolol. There's nothing wrong with that, and I probably would today and tomorrow, and watch that blood pressure. It's not high enough that I would worry about it, but again, metoprolol, like propranolol, is a beta blocker. And suddenly stopping the beta blocker can let the heart kind of go out of control a little bit, which we don't want for you. So a little bit of that beta blocker for the next several days is probably going to be good.
So the half a tablet that he's taking now.
I think that's pretty good. Yeah, you could make a case for taking a whole tablet if you wanted to at that blood pressure. The key thing we want to watch out for is a blood pressure of 40.
40.
Yeah, that'd be too low.
Oh. Okay.
And when people are not cautious and not measuring their blood pressure every day, what can happen is they take their regular blood pressure medicine for several days in a row, and my surgery works on him for several days in a row, and all of a sudden it goes from 170 to 40. So you and I have been in touch almost every day, kind of adjusting and dialing, hopefully doing a good job of bringing this jet in for a landing, as we used the analogy last week. And we want to do the same thing with this in the next several days and the next several weeks. In a perfect world, you would have been cured of your high blood pressure and sugar on the day after surgery. Sometimes we suffer and have to wait 2 weeks to cure high blood pressure and diabetes.
Is the theory that the more weight I lose, the sugar will come down?
Yes.
So that is fair.
In other words, the other way around it is, as you've gotten heavier, your sugar has probably gotten worse. Did you notice that?
Yeah.
Yeah. And the reason is, as you get fattier, as you get heavier and more fat, you become more what's called insulin resistant. And so the insulin that you have can't work enough, and the sugar goes higher and higher. And what we find is within days of the surgery, the insulin resistance begins to go down. And because it goes down so precipitously, so suddenly, and so unpredictably, again, we want to err on the side of leaving your sugars a little high rather than trying to control them too tightly now. Because if we had a sugar of 100 this morning with some medicine on board, we have occasionally had people have a sugar of 40, just like the blood pressure. And a sugar of 40, when you're walking downstairs, all of a sudden you tumble forward, you hit your head, you bleed, you break your hip, and we've had those things happen. We prefer to have your blood pressure at 170 than 40. A perfect blood pressure is 120, 110, something like that, and perfection, excellent blood pressure for you, we predict is in your future. Hopefully without any medicine at all.
Okay, so in general though, since the surgery, like he started out at like 138/64 after the surgery, so he's been creeping up. So,
Right. What do you think that is?
I don't know, why would it be going up?
Do you have kids?
I have a 19-year-old son.
Okay, he comes into you and he says, Dad, I know that the temperature is supposed to drop as it goes from summer to winter, but today's hot. Maybe it's not going to, maybe winter isn't going to come. What would you say? No, winter's coming.
Yeah, absolutely.
I've been through a lot of these seasons. I know winter's coming, right? One day when it goes up doesn't bother you. Anybody dabble in the stock market? Can anybody help me? So if you have stocks, okay, you expect over time they're going to go up. If they go down one day, do you run and sell all your stocks? No? Why not? Because one movement doesn't predict the whole trend. So the 170 is a little high, but that's okay. Because what we know is we have flown this jet in for a landing a lot. You're going down, baby. Winter is coming, your blood pressure and sugars are going down. Now there are actually thin people, as you know, who have high blood pressure and diabetes. And you know, it might be terrible, it might be tragic that you might be that person in whom we get 100, 150, 200 pounds of weight loss and you're still a diabetic with high blood pressure. But probably not. Statistically, our numbers show excellent resolution of high blood pressure and elevated blood sugars after the surgery. So we do need to be cautious. We do need to monitor those numbers just as we're doing, but I'm still pretty confident that when you lose 100 to 150 pounds, there's a high likelihood you won't be a diabetic, you won't have high blood pressure anymore.
And the numbers should be checked by you once a week now, or?
Well, you know, it's easy to email me. You, I think, had sent me some email attachments in Excel, and I don't open attachments because of the risk of viruses. So if you don't mind, just write them in your email,
Okay.
and we'll keep an eye on that every day for as long as we need to. You'll be my pet project. But the neat thing is, see, for most of our patients, is they get better, and I don't have much time to talk with them. You know, in other words, they just get better.
Sure.
Okay, a couple other minor things.
Can Alice jump in for a second?
Oh, go ahead.
Yes, Alice.
I was just to say, part of my concern is, right after the surgery, my sugars are running 380 or so. I mean, it's
Right.
really ugly. And now they're down to the mid-200s.
Right.
And I'm taking some insulin. But I don't want them to stay up, because I have a lot of eye damage, and I'm really concerned that I could lose a little more.
Okay.
So I don't know how long to, you know,
Well, if you
be
want to be
tolerant.
more aggressive in treating your sugars, you may.
Okay.
All right? And you may do that. But remember that every medical treatment that you choose, every surgical treatment, every tablet of aspirin that you take carries a risk with it. So if
Well,
you...
it's just insulin.
Right. And insulin can cause low blood sugar. So,
Yes.
Yeah.
Been there, done that.
right. And that can be... See, in other words, a drop in your blood sugar when you happen to be walking along the street corner can lead to a broken hip, which could lead to surgery and can lead to death.
Yeah.
Okay, we've actually had a broken hip here, one of our patients. In other words, their sugar got low, they were walking downtown, they stepped off a curb, fell and broke a hip. Okay, now, I understand your concern, you don't want high blood sugars, and I agree with you. On the other hand, if you leave your blood sugar high for a long time, that is dangerous. For a few days, I think it's safer than trying to get your blood sugars where you have for the rest of your life, because we know that the surgery itself is bringing down your blood sugars. And that is, we know that from experience just like I was talking about a minute ago. I know as the temperature is going to drop as we go from summer to winter. I know your blood sugar is coming down. I know that other people who have said just what you said have been too aggressive and dropped their sugar and fell down. So you're in charge of your life, and you have paid me a lot of money. I'm giving you my advice. When you're out of here, I will not be creeping around your room saying, drop that insulin.
Well, I generally check about 5 times a day, so.
And I think that's wise. As cautious as you are, then you can be a little bit more aggressive in using your insulin. What you want to be careful about is shooting for perfect and ending
Yeah.
up with a tragedy.
I've never been perfect in anything.
There you go. We like pretty good as opposed to perfect, because the surgery itself is going to kick in.